Hello, everyone. Thank you for joining us today for this webinar today. We appreciate your time for joining us today. This webinar is coming from the Aging Gerontology rig of the SNRS, and I'm going to say a few things about our rig. Just to let you know, our strategic plan for Aging Gerontology rig is as follows. First, to promote the advancement of research for the care of older individuals using innovative approaches to guide and promote the care of healthy, chronically ill, and frail older people. Second, to facilitate networking opportunities and inspiration to nurses and other healthcare providers interested in aging research and aging care in the southern region of the U.S. We meet bi-monthly on the fourth Wednesday of every other month. Most of us will research older adults or care for older adults. So we would love for you to join us if you're interested in older adult research or care. Thank you so much. We want to respect your time, and so I'm going to go ahead and introduce our speaker today. So, Dr. Michael Joseph Dino is a nurse and a researcher specializing in health informatics, Gero-technology, educational technologies, robotics, human-computer interaction, extended reality, artificial intelligence, and academic integrity. He is an Harvard Distinguished Educator and the first Asian to win the Nurse in the Limelight Innovator Award, given by the Connecting Nurses in partnership with the International Council of Nurses. In addition to holding 2 doctorates, Dino is an alumnus of the Experienced Nurse Faculty Leadership Academy of Sigma Nursing and the Global Nursing Leadership Institute of the International Council of Nurses. He is a fellow of the American Academy of Nursing, USA, the National League for Nursing, and the Royal College of Surgeons, Ireland. He is part of the DEFI group, which pioneered the new definition of nursing and nurses 2025 at the International Council of Nurses, and past president of Phi Gamma chapter, the first and only virtual chapter of Sigma Theta International. Among these recognitions, he was one of the top 10 recipients of the Ulster Guardians Global Nursing Award. He is a sought-after speaker with a record of delivering plenary speaking engagements in over 20 countries. He was named the Outstanding Professional of the Year in the Nursing by the Philippine Professional Regulatory Commission in 2023, the highest recognition the commission bestows on Filipino professionals. Join me in welcoming our speaker today, Dr. Michael Joseph Dino. Over to you.
Okay, thank you very much, Eunice, for that very, of course, kind introduction. And first and foremost, I would like to thank you, colleagues, for your invitation to speak at your SNRS rig. And I'm really proud also to be part of SNRS for the Health for All rig. Okay, so at this juncture, I will be sharing my presentation. So can you see my slides?
Yes, we do.
Okay, thank you so much, Shanice. Okay, so again, good day to everyone. And I'm Dr. MJ Dino. I'm an associate professor of the College of Nursing at the University of Central Florida. And for today, I'll be talking about a very interesting topic that I really love, and it's all about technology-driven innovations for older adults. So we will be focusing on community health intervention. So for my presentation, I will be discussing 3 important themes. First is history, second is journey, and third is trajectory. So past, present, and future. So before I start, I would like to mention some of my biases as a speaker. So currently, I'm an associate professor at the University of Central Florida, but previously, before joining, of course, UCF, so I'm a postdoctoral researcher at the same university. I'm a PhD student at the Johns Hopkins University and previously affiliated with Our Lady of Fatima University in the Philippines. Okay, so some of the projects that I will be sharing with you are products of my 2 decades of work that I actually conceptualized way back in the Philippines. And of course, from the Johns Hopkins University and now at the University of Central Florida. So I'm a proud member of of course, our community, the SNRS, and this is a picture um, with me and my, of course, UCF colleagues during the recent, of course, uh, conference of the SNRS in Texas. And one thing, this year is very special because I'm celebrating my 21st year in the nursing profession. Okay? So, way back in the Philippines, I graduated way back in 2005. And fast forward 2026, so I'm now celebrating my 21st year in the profession. And in one of the programs that we had at Harvard, so we were actually tasked to summarize our journey so far in the field of nursing. And this is the same, of course, the slide that I actually shared my peers during that time. And when it comes to the field of nursing, so when I joined of course, the field of nursing 21 years ago, so one of my advocacies as a nurse is to promote the use of technology in everything nursing, nursing research, nursing education, and of course, when it comes to public service, I always integrate technology in everything that I do. And I think that would be of course, my presentation for today. So I will be focusing on how we can bridge the gaps through knowledge translation when it comes to the care of our older adults. So just like what I mentioned earlier, so our presentation will focus on the history, our past, uh, second would be the journey or our present and the future trajectory, of course, in the field of nursing when caring for older adults. So past, present, and future. So let us take a look first at our contemporary world. So I think there's no best way to celebrate the celebrate a 20 decade, of course, service to the nursing profession by contributing, of course, to the nursing profession itself. 2 years ago, I was given this opportunity to become one of the members of the Delphi group of the International Council of Nurses. So, as a member of the Delphi group, we work on the new definition of nursing and nurses. Okay, and one of my biggest contribution to this definition is I emphasize the terminology such as innovation, disciplinary knowledge, technical capability, which relates to the use of technology and innovation in the field of nursing. So if we're going to take a look at the publication that was released, for the definition of nursing and nurse. So this is the new updated definition, and as you can see, I highlighted some of the terminologies that are necessary for us to embrace the roles of modern day nurse. So modern day nurse doesn't only require knowledge and skills when it comes to providing care to our clients, but of course, we need to have some sort of disciplinary and multidisciplinary knowledge, technical capability, and we also need to innovate. Okay, and we function as innovators for the field of nursing. Okay, and one of my principles when it comes to nursing is that nursing is grounded on what we call TLC. Okay? Nurses are, globally are aware that nurses are embedded with these values of TLC. And what is TLC? So it means tender loving care, as our nursing books would always say. But for me, through the years, the meaning of TLC is actually evolving. So TLC would also mean time, love, and commitment. And I know everybody would agree with me when I say that as a nurse, we offer our time and effort, our love and compassion, and of course, commitment to the nursing profession. So TLC would also mean teaching, learning, and communication, and also creating, especially for those who are working at academic institutions just like me, right? So we provide, of course, scaffolding activities to our students. We develop resources or even courses for the learning processes of our students, and we create a lot of resources for the learning of our students. So TLC for researchers would also mean truth, laurels, and collaboration, because a lot of us are developing teams, especially when it comes to contributing to the body of knowledge in the field of nursing. So, every one of us would like to serve our global, spheres, or what we call the global clientele. And for me, a global healthcare provider is one that heals. So meaning, you are a healthcare partner, you are an engaged professional, you are an active researcher, just like what we're doing right now. We are lifelong learner and also servant leader. So coming from initially from the Philippines, of course, I do believe that nurses nowadays are not confined by boundaries, but of course we are trained, okay, and honed to serve our global population. Okay, so currently, because of technology and innovation, I can say that we are living in exciting times and challenging times as well. So if we're going to take a look at our past, so we are actually defined by four industrial revolutions, okay, that somehow shape the practice on how we do nursing. Okay, so first is during the first industrial revolution, where when steam engine was invented, so it actually enables us to travel from one place to another, which led to the transfer of knowledge, skills, and even ideas from a place to another. So second is the production of electricity, which started during the second industrial revolution. And because of electricity, so it powered different cities, okay, and of course machineries that enables the progression of several industries such as manufacturing. And during the third industrial revolution, of course, this is what we call the field of computers. And during this time, computers can be found everywhere at offices, of course, in the community, in different schools, etc. And because of computers, it actually speeds up the manner on how we process data. And currently, we are in the fourth industrial revolution, or what we call the cyber physical system. And when we say cyber physical system, these are sorts of advanced technologies that we are experiencing right now. And if we're going to take a look at the literature, technologies under 4IR includes mixed reality, robotics, artificial intelligence, which is very controversial nowadays. You have self-driving cars, okay? So these are some of the technologies that are very familiar when it comes to the fourth industrial revolution. Okay, so 20 years ago, 2 decades ago, I entered the nursing profession. Okay, so I serve as a critical care nurse for so many years, and also following up with my students, of course, at the same time. So during that time, technology is starting to emerge in the field of nursing in the Philippines. And I remember I one of those individuals who started, okay, the first virtual laboratory in the Philippines. And as you can see here, so our traditional mannequins were replaced by high fidelity simulators. Okay, during the COVID-19 pandemic, so we use technology to, of course, reach out to our students through what we call hybrid technologies such as the smart classrooms. And if we're going to take a look nowadays, we're also venturing into a lot of types of simulation, just like, for example, at UCF. So, and just like other nursing schools, we are utilizing technologies such as the hologram, the immersive rooms, and of course, mixed reality. And if we're going to go beyond, of course, the walls of our universities, there are also schools or facilities in other universities that are actually being converted in what we call digital form. Okay, and we call it the smart, no, the smart universities or twin universities or virtual universities. That in addition to that physical infrastructure, some universities are also offering a virtual version of their facilities. So if you are a student in the School of Nursing, so you can actually explore the laboratory, for instance, an anatomy laboratory virtually, in addition to the physical infrastructure that is being offered by the college. Okay? So the very first technology that I deployed in the community for the care of older adults was actually telehealth program. Okay, so I think this was in 2000. This was launched way back in 2010. Okay, so during 2010, internet is just starting to emerging in the Philippines, and one of the programs that I deployed there is of course telehealth. So what I did is we developed a community training center for telehealth for older adults in collaboration with local universities and of course the local government. Then after that, we allow our older adults to communicate to their healthcare providers using computers and of course the internet. And during that time, so this telehealth program was actually replicated in a lot of places and regions in the Philippines and even in Indonesia and of course in Malaysia. So, the reason why I actually advocated for the use of telehealth for older adults is that because of the geographic characteristics of the Philippine, of course, the Philippine region. So if you're going to take a look at it, I started a program in a place called Marilao, Bulacan, which is divided by, rivers and other geographic features. And the telehealth center was located in the metropolitan area in front of a university, of course, in the Philippines for technical support. So the program ran for a lot of years before it was upgraded into a better facility. And every 6 months, we are training older adults, okay, in different places on how to use computers and the internet. Okay, so fast forward several years, we are now um, living into the future of the nursing profession where also artificial intelligence being embedded on our practice. Okay, so nowadays, our patients are not only communicating with real ones, but of course, they can also communicate with what we call avatars. And because of artificial intelligence, so we are now furthering into a field called precision medicine, where we can further tailor fit the care that we are giving to our patients using, of course, their patient data, okay, and using artificial intelligence. So a year ago, I actually ventured into a research where we develop a lot of large language models, especially for applications that are related to caring for older adults. And if we're going to take a look at the global trends, these are some of the technologies that might affect the manner on how we deliver our services to our client, including older adults. So according to studies, Of course, in the near future, there will be lots of robots that are energy efficient. Okay. Um, there are also robots that can automate some of the task, and some robots that can be used to perform other functions, not only for example in the industry, but of course in the healthcare field as well. So in the same year as I launched the telehealth program in the Philippines, I also do collaborations with my colleagues in Japan, specifically Tokushima University, which is 4 hours away from Osaka City in Japan. And during that time, I became an ambassador of the Rotary International and work on several projects with robotics, okay, in several hospitals um, in Tokushima area. And during that time, so we program robots to act as exercise coaches to older adults. Okay, so in Japan, technology is really advanced, and I think Japan is one of the countries who started using robots, okay, in their healthcare facilities, especially for facilities related for older age older adults, or aging centers as we call it. Okay, so this is me way back in 2010. Okay, working on some research related to the impact of robotics to older adults. Then when I w- became a scholar at the Johns Hopkins University. So I also extended, of course, my interest for robotics research. And I remember during that time at Hopkins, so I published a literature review on nursing and human-computer interaction in healthcare robots for older people. And this is an integrative review summarizing all the robots that has been used for the care of older adults. And in this particular publication, so I advanced a three-tier robot classification. And in this particular publication, so I have there a diagram on the common robots that is being used in older adults globally. Okay, so I categorize them into three: the zoomorphic robots, or those animal resembling robots. We also have functional robots and anthropomorphic robots. So as you can see, most robots that are being used for the care of older adults is anthropomorphic and functional. So anthropomorphic, these are human resembling robots. So you can see a distinguishable head, you can see distinguishable hands, okay, for these robots. And they have the capacity to move around because of their wheels. And for functional robots, these are robots with no, human defined features, but can also act as, of course, a tool, especially when it comes to rendering care, or different types of interventions in the hospital. Okay. So robotics is not only the technology that's emerging when it comes to older adults, but of course, we have what we call the extended reality technology. And in 2024, Apple actually released one of the technologies that are envisioned to change the practice forever, not only in healthcare but in other industries. And we know that this is Apple Vision Pro. So during the launch of Apple Vision Pro, there are also some health apps that were released during the time, just like what you are looking right now. So this is an application for relaxation to reduce anxiety among patients, especially those that are confined in the hospital. And for me, this is very, innovative, because we are now using the power of extended reality technology to provide service or care to our community. So the extended reality um, concept in healthcare actually started way back in 1994. Okay, and during 1994, researchers Milgram and Kishino advanced one of the models known as the reality virtuality continuum, or a possibility for us to combine both real world and virtual world. Okay. So I remember during the early 2000s, there's an application that was actually produced. Okay. And we call it this is for entertainment. This is some sort of a game. This is Pokemon Go. Okay. So I'm not sure if you're familiar with Pokemon Go, but that is an application where you can use the camera of your cell phones. Okay, and when you use the camera of the cell phones to scan your environment, you can see monsters where you can catch. Okay, because Pokemon Go or Pokemon means pocket monsters. Okay, this game was actually came from Japan. And this is very innovative because using the camera of your cell phones, you can catch monsters or digital monsters that you can see from the screen of your mobile phones. So this is an example of reality virtuality continuum. And there are three main technologies under reality virtuality, and I think you are very much familiar with this. So you have the virtual reality, so using that VR glasses, as we call it, or head-mounted device, so we can be transformed into other places. Augmented reality, just like the Pokemon Go. So using the cameras of your mobile devices, you can project digital objects, just like what you are seeing on the slides right now. But for me, at Johns Hopkins University, I started, a program that utilizes what we call mixed reality. So there's a difference, no, differences between these three technologies. For VR, so the head-mounted device is enclosed in your eye area, so you cannot see anything but the ones that is being projected in your head-mounted device. For augmented reality, using your mobile devices, okay, so you can add digital objects to your environment. But for mixed reality, so these are actually previously these are head-mounted device with see-through features. So it's just like wearing eyeglasses. Okay, it's just wearing eyeglasses. And for me, this is more appropriate for older adults because older adults tend to have headaches or dizziness after using VR. But for mixed reality, since the technology uses pass-through technology, so they can still see their environment, the real environment, while, of course, seeing those digital objects in front of them. Okay. So mixed reality is just like this one of the earlier devices that was produced during the time is the Microsoft HoloLens. Okay, and through this pass-through technology, you can project digital objects in front of you, just like this particular slide where a person can manipulate an anatomical model. So make it bigger, make it smaller, and even, of course, dissect the different parts. So when I was a student at Johns Hopkins University, they are using it especially to immerse their students in different scenarios, okay, clinical scenarios prior to actual implementation or actual exposure to the hospital. So Microsoft HoloLens produced a lot of cases where we can use this in the healthcare field, and that includes interpersonal collaboration. Okay, just like what you are seeing right now, a medical doctor communicating with, of course, a person from the radiologic department while giving, healthcare information to the patient. Okay, another thing is mixed reality can also be used in the field of nursing education. So remember, I mean, you can imagine at the comfort of your own homes, you can teach to your students as being represented by avatars, and students are attending classes in the comfort of their own homes. Okay, so while also wearing that head-mounted device, so the possibilities are really endless. Okay. So during my stay at Hopkins, I was really fortunate to be mentored by two, of course, very prolific nurses, well-known nurses in the field. So one is Dr. Patricia Davidson and the other one is Dr. Kenneth Dion. Dr. Kenneth Dion, particularly, is one of my idols in the nursing profession, along with Dr. Patricia Davidson. And this time is very memorable for me because during that time, I serve as the president of the Phi Gamma chapter of Sigma Theta Tau, and Phi Gamma is the first and only virtual chapter of Sigma. So this is very unique because we have members in different parts of the globe. It's one of the biggest chapters of Sigma, and I serve as a president for 2 years after serving as the vice president and programs director for the previous years. So my presidency at Sigma also is concurrent with the presidency of Dr. Kenneth Dion at Sigma at large. So during that time, he is the president of Sigma at large and also my mentor at Johns Hopkins University. And I remember during that time, he has this a presidential call to action, which is tagged as the Be Bold presidential call to action, which is composed of three important uh, initiatives. So initiatives related to economics because in addition to being a nurse, Dr. Dion is also an economist. So another would be conservation, that with the use of innovations in nursing, we can actually save time and effort. And finally, there's also a component of her presidential call to action related to technology. And one of the best things that I have learned from Dr. Kenneth Dion is we can actually reserve resources when it comes to the use of technology in the nursing profession. Okay, so and that is what I'm doing for the past several years, using technology to serve our older adults, especially in developing countries such as the Philippines. I have programs in Indonesia, Malaysia, Thailand, and of course in the Philippines. And these are developing countries. And you know, developing countries have issues when it comes to their resources. Until now, I'm actually helping a lot of colleagues in this area, especially in their technology-driven interventions. And another question would be, why older adults? Okay, because for me, I think promoting the health of older adults is one of the challenges of the century. So in my instance, I'm providing service to older adults using what you call the PPP, or public partner partnership. So I have partnered with a lot of private and government organizations previously to advance my advocacy in the Philippines. And we actually combine service with technology and also doing research at the same time for us to see and take a look at some of the ways on how we can, serve um, older adults and do research at the same time and understand their particular needs. And one of the peculiar things about my program is that we always develop applications, especially for mobile health, for older adults. So while we are doing research, we are discovering a lot of, we are discovering a lot of insights on how older adults use technology, and we always adapt those insights to what we call um, knowledge translations or into actual practice. So when we discovered something about older adults, we integrate that on the application that we're doing. Okay. Once we develop we identify their preferences, uh, we craft the technology based on their preferences. So we are adopting what you call knowledge translation in the practice of care for older adults. So the population is actually aging as we reviewed, no, the different literature, and it is expected that majority of our older adults are residing in developing countries such as the Philippines. And um, the COVID-19 pandemic actually provided us a lot of issues and problems when it comes to the health of older adults. Because based on research, one of the biggest problem actually introduced by the pandemic for older adults is being inactive. So during the COVID-19 pandemic, there's physical decline among older adults. There's also cognitive decline because of inactivity, because they are confined at their own homes. They cannot, of course, go outside and perform additional exercise, especially for community health centers. Okay, and way back in 2000, I think this was in 2021, I started a literature review program to identify the minimum basic requirements for exercise and mobility for older adults. So we developed this literature review and produced recommendations when it comes to the number of times that older adults must exercise, what type of exercise, and of course the duration per week. And it includes exercise related to endurance, strength, agility, and balance. So, since the start of my career, my population of interest is older adults, maybe because I'm very close to my grandparents, especially when I was young. I'm very close to my grandmother and grandfather. And if I may share, I'm always interested with documentaries that are related to the care of older adults. And one of my favorites is Live to 100. So this is one of my favorite Netflix documentaries, and it's actually a documentary about centenarians. So when we say centenarians, these are individuals or persons who actually live 100 years and beyond. And according to the proponent, which is Dan Butner, who also produced a book that we previously used at Johns Hopkins in one of our courses. So the book is entitled The Blue Zones of Happiness, and according to Dan Butner, there are actually five places, okay, located in different parts of the world, no? So there are five places globally that are considered blue zones of happiness. So when you say blue zones of happiness, these are the areas where individuals, the average life expectancy is 100, or there are lots of centenarians in those particular areas. So I've been to three of these blue zones. Okay? And prior to the pandemic, I visited, of course, one of these blue zones, and this is in Loma Linda, in California. So I have colleagues in Loma Linda. So because this is an Adventist community, and while working on some projects in the Philippines, I came across a lot of Adventist organizations. So some of my colleagues are working in Loma Linda. So when I visited there, so I discovered that uh, in that particular area, so there's a sense of community. So you can feel that people are really coordinated. They have weekly activities or even daily activities, promoting, of course, health and well-being for their community. But they are really cohesive, as that's one of my conclusions. Okay, and I'm also working with a lot of frameworks in my projects, and one of the frameworks that I'm using a lot is the behavior change wheel. Okay, and because this framework advances that the development of healthy living, okay, is actually affected by a lot of factors. And as healthcare providers, we can use a lot of strategies for us to change the behavior of individuals for the betterment of their healthcare. Okay? So that's one of my advocacies, caring for our aging society. And one of the programs that I launched when I was PhD student at Johns Hopkins University is the virtual coach for older adults. So this is the concept that I developed several years ago. So this is actually my actual drawing. In my iPad, whenever I have free time, so I do sketches on related to my future programs, right? So in one afternoon, so I actually sketch a concept, and I told myself I want to work on a paper or a project related to the use of mixed reality devices, specifically the development of a virtual coach for older adults. And during that time, I'm taking a lot of courses at the Bloomberg School of Public Health. So I learned about how we can make technologies more human, okay, through this what we call human-centered design, which is actually composed of several steps such as inspiration, ideation, and implementation. So for me, the impact of this process is we can develop technologies, especially at the beginning, okay? And when we are still developing technologies, we can already integrate what the preferences of our older adults are. So during that time, I developed this framework on how we can, develop more older adult inclined technologies. And I started also this program research program, an exploratory sequential mixed method design on testing, different interventions for mixed reality, including virtual coaches. So I also publish a lot of studies related to the care of older adults and how virtual humans are being used previously in other cohorts of patients, not only older adults. So I publish a lot of frameworks on how we can make um, these technologies very viable for our older adults, and even summarizes or summarize the different technologies under extended reality that is being used for older adults. Okay, so the question now is, how did I translate some of the evidences that I discovered to the practice of taking care of our older adults? So I'm really fortunate because I received a lot of support when I started this program. Okay, so one of which is from the Department of Science of Technology in the Philippines. I was given this multi-million funds by our Department of Science and Technology when I launched this program in the Philippines. So this funding enabled me to develop one of the research laboratories, okay, for the development of virtual coaches in the Philippines, and this is tagged as the Marvel technology, also known as the Multiple Applications for Reality Virtuality Experience Laboratory. So what makes this laboratory special is that we are harnessing the what we call the motion capture technology for us to develop this virtual coach. And during that time, so this was published in several media channels in the Philippines. So this is the picture of the laboratory. So as you can see, there's a motion capture area where we capture the movement of actual coaches, and we have the technology development area where we a program, the virtual coach to be used for head-mounted devices. So during that time, we were also featured by CNN Philippines, one of the news outlets in the Philippines. And in this video, which is also available at YouTube, so it actually tells the story of how Marvel was conceptualized, and what is our vision for Marvel in the near future. Okay, so using, of course, mixed reality technology, not only for programs for the community, but of course for nursing education as well. Okay, so I think these are some of the screenshots in that particular video. And after the deployment of the this laboratory, we started developing the the virtual coach. So the location of the pilot of this study, so several years ago, was two areas or senior centers in Valenzuela and Quezon City, okay, in Metro Manila. So if you have been to the Philippines, Manila is the capital, and these are the most dense when it comes to population of older adults. So we collaborated with two local governments during that time. And we also involved our nursing students at the College the College of Medicine during that time. So we pilot the initial version of the virtual coach. Okay, so we started with a question: what virtual coach programs preferred and effective for older adults in the community? So using research and conjoint analysis, so we developed, of course, the program coming from the insights that we generated from this conjoint analysis. So we use Sawtooth software after collecting data, and we found out that platform is the most important attributes affecting the utilization of virtual coach among older adults. And surprisingly, I thought if this is an exercise program, music is, an important attribute. But we found out in our research that music is the least preferred attribute as compared with other attributes. So using the results of our conjoint analysis, we developed the uh, three types of exercise program based on the preferences of our older adults. So because of this particular research, we were able to group older adult users into three categories. Those that we called explorers, okay? So we have also a group we called listeners, okay? And of course, the viewers who tend to focus more on, the virtual or the digital assets that they can see while wearing those head-mounted devices. Okay, so not only conjoint analysis, we also did eye tracking study, okay, for human-computer interaction. So we projected the digital virtual coach in the wall, and we asked older adults to wear the eye tracking device. And I'm really happy because after several years of review, so our study on cognitive walkthrough was published, of course, last week. Okay, because I submitted this in one of the top journals in computers and psychology. So, the problem or the challenge when it comes to publishing to top tier journals, sometimes the review is very much extensive. So, yeah, I received a yes 2 weeks ago. And after several days, it was, made available to the public through open source publication. Okay? So we did a lot of studies. I think we produced more than 10 studies to develop the final version of the virtual coach. That includes computer vision, that includes eye tracking study, and also we utilized a lot of valid and reliable tools appropriate for the elderly. And we found out that there's a significant difference between the two groups of our, the older adults who utilize traditional exercise and those that who utilized mixed reality technology. Okay, so these are some of our initial publications, but now I think I have more than 10 publications related to this project. Okay, so the question is, how did we develop the virtual coach for older adults in the community after we discovered, of course, a lot of research insights? So prior to that, I had several trainings abroad. So we had trainings for motion capture in London for 2 weeks. Okay, and while still a student at Johns Hopkins University, so I also received a scholarship in Singapore for Unity. So Unity is the software that we're using for virtual coach, and we receive a lot of training for how we can, combine these technologies to develop digital assets. So once we capture the movement of an actual coach, we convert that into virtual coach and to this mixed reality platform, as you can see in this particular slide. So we have lots of, motion capture sessions before we finalize the virtual coach. Then we came up with a lot of iterations of virtual coach. So our target during that time is to develop virtual coach that looks like Filipino, right? Because our initial clients are Filipino, so we would like them to look like Filipinos, so that our older adults would actually recognize, oh, this is a Filipino coach. Okay, so we developed two versions. we develop a male and a female, and for the program, all the adults have the option whether to choose the male or the female. Okay, and we found out that if our client is male, so he preferred a male coach, and if our older client is female, so she actually preferred a female coach. So a lot of insights were generated, including the use of music, how can we make them use this virtual coach, what are the factors that might affect the use of virtual coach for older adults. So this program is still running right now because of the support coming from a lot of uh, organizations in the Philippines and in abroad, and also from Sigma. So this particular program became really sustainable. And I'm really happy that until now, so there are areas in the Philippines who are actually using, of course, this program. So we were able to publish also qualitative research, phenomenological research related to their experiences, all our older adults' experiences in using this virtual coach. And the themes are summarized into four: the looking around experiences, the looking at experiences, the looking after experiences, and the looking ahead experiences. So I think this was published open source. So you can actually read the outcomes of this study. Okay, so what we have learned from all of this, okay, in using technologies for the care of older adults. Okay, so number one, is the importance of what we call sustainable collaboration. If we want our technologies to become sustainable, so we need to partner with the right individuals. Okay. And when I became a postdoctoral scholar at UCF, so we initiated a lot of partnerships, and hopefully this will materialize. Of course, in the future, if we will be getting funding for this. Okay? So, and we need a lot of support coming from private and public organizations. So I remember we produced this, reference or booklet that were distributed to older adults. Okay? Those who prefer a different, different platforms of exercise. And also reaching out to some of my colleagues at Johns Hopkins University, we're also discovering on how we can make this program more comprehensive. I mean, um, adding an AI component to it, that in addition to teaching exercise, older adults can also converse with the virtual coaches. Okay? So, and a lot of conferences. I presented this to a lot of conferences already, and when I present this project, so we receive a lot of support coming from individuals and organizations. Okay, second thing. Okay, so I have learned that really with great power comes great responsibility. So technology is considered power for me. Okay, because especially right now, AI is really powerful. And as nurses who are planning to use technology, we also need to be responsible in using it, right? Because technology has positive and negative impact. And as nurses, our role is to mitigate the negative impacts of technology and maximize the positive impacts of technology. Okay, so hopefully we can further refine this project using AI, because we believe that humans armed with AI outperforms those without AI. But we are taking it, slowly but surely, because as much as possible, we would like to inculcate, you know, uh, what we call hybrid artificial intelligence. So there's a concept that's emerging right now, hybrid artificial intelligence. So this model proposes that with the use of technology such as AI, you need to always, embed what you call human caring. So you don't need to rely to AI 100%, especially if that is healthcare. So you need to make sure that if your clients will be using AI, so there are also opportunities for them to communicate with real person, to inject, a lot of elements that concerns human intervention. Okay? So we also promote the use of AI in all levels. However, this should be, of course, human intervention at the beginning, at the end of the program. Okay, so when we completed the Marvel project from the funding from the Philippine government, we produced, I think, 4 applications in addition to the virtual coach. We also produced a basic life support module for older adults. And since my former university also offers maritime education, so we also developed this immersive space where the maritime students can navigate co- um, several ports in the Philippines using that immersive technology. Okay, so after 2 years of implementing the Marvel program, so I received a recognition coming from the Philippine government, specifically from our Department of Science and Technology and our team. Okay, so we received this, what you call the EPIC Award, or the Excellence in Project Implementation and Completion Award, because our Marvel project, funded by the government, is one of the best innovations that were implemented in the Philippines during that time. Okay? So for me, if you will combine community service, technology, and research, so that is equivalent to serving others or illuminating the light for others. Okay? So, and as I end my presentation, I would like to share this one of my favorite quotes from Leo Tolstoy. So, Tolstoy mentioned, just as one candle lights another and can light thousands of other candles. So, one heart illuminates other heart and can illuminate thousands of other hearts. So as nurses, we have the power to use technology for the care of our clients, and sharing the benefits of technology is just like, illuminating, of course, the lives of others, just like, of course, candle. And this was actually inspired by one of my favorite festivals in Asia, and this is the Chiang Mai Yipeng Festival, or the Lantern Festival. So whenever I experience this festival every year in Thailand, I always remember that as nurses we are lights, and as lights we need to illuminate others. So, and in the Philippines we call that Lumina Pandit. So you need to light your candle first before you can illuminate the paths for others. So light the torch and pass it on. Okay? So with that, I hope I've shared, of course, my projects and some of my initiatives. Thank you for this platform, and thank you to SNRS for allowing me to share, of course, my advocacies in the care of older adults integrating technology. Thank you.
Thank you so much, Dr. Dino, for that wonderful and very loaded presentation. You've covered a lot. Thank you so much. And for your contribution to the care and research of older adults. That's wonderful. Even though our time is past spent, but I wanted to ask if anyone has a question or questions. Do we have questions from the audience? Our speaker will not mind responding to those questions, helping us find answers to them. Do we have questions?
I have a question. Hi, this is Latarsha. By the way,
Hi.
I'm blown away with your presentation and the work that you've done. I mean, this is awesome. My research interest is in the use of technology as well, little robots, older adults in
Wow.
space. So I just want to know what, if I missed it, I apologize. What type of barriers? I know you talked about the lived experiences, but what type of barriers that you encountered when you tried to actually operationalize this in the older adult setting? Like, was there a learning curve? I know you talked about usability, but I'd like to hear a little bit about more about the challenges and maybe pitfalls maybe I can avoid those in my study.
Okay. Yeah, thank you very much. That's a wonderful question, and I'm really glad that you're also using technology, of course, in your research for older adults. Yes, you are correct. So one of the most common challenges that we experience in this program is more on the usability part. Because I think one of the issues nowadays is when we implement a technology for older adults, sometimes it's already completed. Okay, so I mean, for example, if you're going to use an application, so most of the time the application is already completed or already developed before we deploy it, right? So what we have learned from the past would be we need to involve older adults, especially during the early stages of developing technologies. Okay, because at the end, if they want to change something, so it will take us time to, to change the programming, to change that particular feature. But in the development, for example, of our virtual coach, or during the time that I have worked with my Japanese colleagues, during the initial stage of development of the technology, so we started involving older adults. We developed surveys, we interviewed them on their, preferences, because usability is very much important. Considering that our older adults are experiencing a lot of challenges when it comes to their senses, the manner on how they move. So we need to um, consider those physical and of course cognitive challenges of older adults. So I remember also while developing the virtual coach, we need to include labels to make it very inclusive, especially for those older adults who cannot see or they cannot distinguish some icons. Okay, and I think I would like to also share one of the frameworks that we use. So in our research, we deployed the model called UTOUT, or the Universal Theory of Acceptance and Use of Technology. So the UTOUT theory was actually produced by Venkatesh and et al. And according to the theory, there are four important factors that might affect the use of technology among older adults. So first one is performance expectancy, or the perception among older adults that using this system will help them in some way, maybe to improve their health, to improve their cognition, etc. Second is effort expectancy related to usability, or the user friendliness of the system. If we want older adults to use technology, we need to develop technologies that are usable for them, right? That might include the colors, that might include the features, or that might include the interface on how they can interact with those applications. Another one is social influence, or the perception of a person that those individuals that are dear to me would like me to use the system. So it means when deploying a technology program in the community, you also need to develop a sense of, belongingness. So meaning, if you cannot implement it individually, you need to develop a community of technology users, so that older adults can be inspired to use this technology. And the other one is facilitating condition. You need to provide support, because if there are no support on using this technology, it will not become sustainable. It will be a one shot, program. But if you provide continuous support to the program, maybe a hotline, or maybe some persons that they can communicate to if they have issues in using the system. So these factors are really important for us, for older adults to use technology, especially that they are experiencing additional challenges when it comes to senses, sensory, and of course, physical challenges. Okay. Thank you so much.
Thank you. That was perfect.
Thank you, Latarsha.
I have one question. I'm Carolyn Sulain. I teach gerontology and nursing up under the BSN and graduate department. And how usually friendly was your technique
Yeah.
for the buy-in, for them buying into.
Thank you. Thank you, Carolyn. Yes, these are very user-friendly and very simple. So I remember when we deployed the telehealth program, you
Mhm.
know, using computers sometimes seems to be complicated because of a lot of buttons, a lot of process before you can open, for example, Zoom or other, softwares. So what we did is we developed an interface called the senior software. So we call that the SS or the senior software.
Mhm.
So uh, when the older adults open their computer, so the application automatically loads on the interface, and it actually contains only two buttons.
Oh,
One is to open and one is to quit the application.
okay.
So because if you let the elderly, turn on the computer, you open this, you open that. So there's a lot of instructions.
Right.
So they might not use it in the future. So what we did is we developed a specific third-party software that when they open their computer, it will automatically load and there are only two buttons to connect and to quit. Okay. So that's how user-friendly it is. And also we discovered that older adults would prefer darker colors, okay, at the interface as compared
Mhm.
with lighter colors, which is, far for expectations because we hypothesized that they would prefer, soft colors, lighter colors, but not. So in terms of readability, so they prefer darker colors as compared with lighter colors. So several things like that. The manner on how older adults use technology is different from how we use technology or even their younger counterparts. So we need to be considerate on their specific needs. Thank you, Carolyn.
Thank you. Thank you.
Do we have any other question? I'm looking in the chart. I didn't see any question. Well, thank you, everyone. Our time is fast spent, so we would like to release everyone for the rest of the day. Once again, I want to thank our speaker for today. Wonderful speaker. You have done a lot of work. So impressive. Thank you so much for your contribution to the community, to the older adults, to your students, to the institutions. Thank you so much. So thank you everyone for joining us today. We appreciate all of you and thank you for your time. Thank you. Have a wonderful day.